Okay, so sometimes again during the pregnancy, that low back pain can creep up on us. It's nice to be able to do some stretches. Stretches are great to do. If you've already had a chance to do some of the foam rolling or the ball rolling, loosen up these muscles first, get them some blood flow, and then it's a perfect time to do some stretches. So if you've done your rolling, then it's a great time. You can try a couple different ones. So you can try a little bit of a cat-cow movement. Again, being able to arch your back, stick that tailbone up in the air, and then tuck it under. Sometimes it's nice to coordinate this one with your breathing, being able to take a nice deep breath in, and then breathing that air out, tucking under. Now with all these stretches, you take it at your own speed. Some people like to do it kind of fast, shake it out a little bit. Some people like slow and methodical. Whatever works for you is great. Child's pose is also one that tends to be a favorite. Now for child's pose, you want to keep your knees a little bit wide, just make room for the baby here. And you can kind of do it with your arms stretched out and kind of getting a nice stretch through your low back. But you might find like, oh, that's a little bit intense. Some people like to prop their head up and keep their bum up in the air a little bit. So just have a nice stretch there. But usually when you get into the spot that works well for you, you just want to hang out there all day. You're like, oh yeah, this is the spot that feels great. Great to do again after a long day of working if you've been sitting, just to help shake out these muscles. If you want to get a little bit of a bigger stretch through some of these tight hip muscles, you can do a pigeon pose and being able to sit down in the hip a little bit. Sometimes that feels like a big stretch through our hip capsule, so just make sure you don't feel any groin pinching with this one. You can be able to switch it up and try different legs. So you bring one leg in front, one leg goes behind. You untuck your calf a little bit and you can kind of sit down into the glute, play around with it, keep it moving, keep it dynamic. But again, depending on how big the baby is, this can be a little bit sore on your wrists or get a little bit sore through the hips. So sometimes a nice modification that we like to do is just having a chair handy, and then you can be able to hold onto a chair and you can put your hip onto it and just get a nice stretch that way. But this way you're not holding up your whole body weight. You can kind of play around with it a little bit. So see if you can stretch into these muscles in a way that works for your body. Shouldn't be painful, should just be a nice stretch feeling. And again, doing these stretches after you've had a chance to roll is a fantastic way, especially for that nighttime pain.